Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hello, and welcome back to the Friendly Pharmacist podcast. I'm your host, Nario Cantu, and today we're diving into one of the most critical yet overlooked issues in healthcare, medication adherence. Now, let me ask you something. Have you ever dispensed a prescription, provided counseling, and then found out later that the patient never picked it up? Or maybe they took it for a few days, then stopped because they felt fine, or on the flip side, because they couldn't afford it. If you're a pharmacist, doctor, or caregiver, this story is all too familiar. The reality is medication non-adherence is one of the biggest barriers to effective health care, leading to worse health outcomes, hospitalizations, and even deaths. And here's the kicker. It's largely preventable. So today we're going to break it down why patients don't take their meds, how it affects their health, and what we as healthcare providers can do to turn the tide. What is the real cost of medication non-adherence? Let's start with the numbers. The CDC estimates that 50% of medications for chronic diseases are not taken as prescribed. That's half. And the cost, a whopping $300 billion per year in avoidable healthcare expenses. Think about that. Hospital admissions or visits, complications from uncontrolled conditions, and more, all because patients don't take their meds as prescribed. But beyond the financial impact, the real tragedy is the human cost. Non-adherence is responsible for 125,000 deaths each year in the U.S., and that's just the reported cases. For conditions like hypertension, diabetes, and heart disease, missing doses can lead to strokes, kidney failure, or heart attacks. And for mental health medications, stopping suddenly can cause relapses and severe withdrawal. So if adherence is this important, why aren't patients taking their meds? Why do patients struggle with medication adherence? There's no one-size-fits-all answer. Patients miss doses for a variety of reasons. But here are the biggest culprits. Life is busy between work, family, and everything else. Remembering to take a pill twice a day can be tough. Many patients stop taking their medication because of side effects that we, as pharmacists, could help manage. Some medications are just too expensive. And if a patient has to choose between buying groceries or refilling their prescription, the decision is obvious. This one is common with conditions like high blood pressure. If they feel fine, they assume they don't need them. Some patients are on 5, 10, or even 15 different medications. Keeping up with that is overwhelming. Some patients don't fully understand why they need the medication or don't trust the healthcare system. So how do we as pharmacists bridge the gap and help patients stay on track? Practical strategies to improve medication adherence. We're in a unique position as pharmacists to educate, empower, and encourage adherence. Here's how we can do it. Leverage technology. There's an app for that. There are smartphone apps, text reminders, and even automated pill dispensers that alert patients when it's time to take their medication. Pharmacies can integrate refill reminders via SMS or mobile apps to keep patients on schedule. Simplify regimens. Less is more. Whenever possible, we should work with prescribers to reduce pill burden by suggesting combination medications or extended-release formulations. If a patient is taking multiple meds at different times, can we consolidate? Offer medication synchronization. A once-a-month pickup instead of multiple trips. Game changer. MedSync programs help patients get all their prescriptions filled at the same time, reducing missed refills. Address financial barriers. Is there a more affordable option? Many patients simply can't afford their medications. This is where we as pharmacists can step in, find generic alternatives, recommend manufacturer discount programs, connect them to patient assistance programs, educate them about prescription discount cards. If cost is the issue, we can be part of the solution. Improve patient counseling. Speak their language. A quick take this once a day with food isn't enough. We need to engage, ask questions, and listen. If a patient is hesitant, let's dig deeper. What concerns do you have about this medication? Using plain language, avoiding medical jargon, and offering printed materials in multiple languages can go a long way. Personalized follow-ups. A simple call can save a life. A quick phone call or text to check in with a patient can make a big difference. Some pharmacies have implemented medication therapy management programs, offering scheduled follow-ups to ensure patients are sticking to their treatment plans. Family caregiver involvement. Sometimes the best adherence strategy is having someone else involved, whether it's a spouse, a caregiver, or even a child reminding grandma to take her insulin. At the end of the day, we are the last line of defense before a patient walks out the door with their prescription. Our role isn't just to dispense pills, it's to educate, advocate, and support patients in their journey to better health. By implementing simple yet powerful adherence strategies, we can help prevent hospitalizations, reduce healthcare costs, and most importantly, save lives. So the next time you counsel a patient, ask yourself, what can I do today to make sure they take their medication tomorrow? That's all for today's episode of the Friendly Pharmacist podcast. If you found this helpful, share it with your fellow healthcare professionals, and let's work together to improve medication adherence. Until next time, stay friendly, stay informed, and keep making a difference.